Without TRAM track, my research, I think I'd still just be 6 months behind, still just staring at a computer screen, wondering how on earth anybody has a startup.
TRAM track was a 8-week intensive looking at what is the commercial feasibility of what we're working on.
If you are left leaving the boot camp with this hunger, this urge to know more, TRAM track is just the perfect way to kind of answer those key questions about your own research that you would need to answer to start a business.
We aim to give them that level of business literacy and teach them how to put a commercial lens on their research and understand how do you turn a research project into a viable and marketable product or service.
It was the first time really we got pushed to go from we have an invention we think is useful to actually engaging with customers.
And you really thought, I know what I'm doing, I'm going to change the world with this. And TRAM track was all about tearing that apart.
It's quite common for teams to come into track with an assumption around who their customer is and have that assumption completely blown out of the water. I really love to see that penny drop moment when teams really understand this is who my customer is and this is the problem I'm solving for them.
TRAM track fosters a very collaborative environment, so we became friends with all the other teams. We got used to what they were doing. You're sort of taking on the emotional ride with them.
We got a lot of connections, we were constantly networking, and we just got the skills and the know-how to actually back up everything we'd been saying up until that date.
The language that we all used at the end of track was very different. We all got a clearer idea of what commercialization really is.
After conducting about 22 customer interviews, we discovered that the way we were defining the problem completely changed.
We'd spoken to a lot of people, we realised who the key decision makers were. There's all these pivots means that you're constantly getting new knowledge, you can constantly refine your business model.
Without TRAM track, our research would have just remained in academic publications.
I think my research would be a lot less developed. It wouldn't have that depth in thought, not just about the scientific problem, but all that commercialization aspects, the market size, who am I really hoping to help with my technology.
It changes how you look at your research. The acts of talking to end users, talking to potential customers in a technical field related to your inventions and research is invaluable in ways you haven't even thought of yet.
Welcome everyone. It's a pleasure to welcome you to our TRAM track presentation day for 2021. My name is Bonnie Zhang. I'm the program coordinator for TRAM and I'm thrilled to be your MC today. I'm proud to be speaking to you today from the traditional land of the Wurundjeri people of the Kulin Nation. It gives me great pride to be able to acknowledge the Wurundjeri people as the traditional custodians of this land to this day which has never been ceded. I am honoured to pay my respects to their elders, past, present and emerging. I'd also like to extend that same respect to any Aboriginal or Torres Strait Islander present at today's event. As many of you are dialing in from around Melbourne and across Australia, I encourage you to reflect on the traditional custodians of the land you're on. The purpose of today's presentation day is to celebrate our fantastic 9 teams of researchers who have participated in TRAM track this year. Over the past 8 weeks, our cohort of 20 researchers have embarked on a brave journey to answer a key question. Whose problem does my research solve? To this end, as a collective, they conducted over 200 interviews with potential customers, ranging from 14-year-old high school students, biotech companies, captain of the St Kilda AFLW team, to city council members and mushroom farmers. How about that diversity? We often refer to this journey as a roller coaster, and I'm sure our track researchers are out there nodding along. Like them, this too has been my first taste of the track program, and I've definitely been learning alongside. Coming from a research background myself, I have seen firsthand the time constraints between grant writing, teaching, running research groups, and everything else that life has to throw to us. We even saw 2 wonderful researchers submit their PhD theses in this time, Tremendous effort to Janan and Jayin. You've also all, I'm truly amazed that in light of all of this, our researchers have put in unwavering effort to progressing their research impact journeys. You've also inspired me to reflect on how I can progress my own research, and I have a strong feeling that this sentiment will be felt amongst our audience today too. Today, we will hear from each of the 9 teams with a 3.5-minute presentation, and rather than a traditional pitch, they will each speak to us about their research impact journey to date, telling us what learnings they've learnt and share with us their next steps and how we can support them. At the end of the event, we encourage you to stick around and join a separate Zoom networking session with our teams to ask them some questions. So now I will handball over to our program manager, Andrew Rouse, and then we'll jump straight into the presentations.
Thank you, Bonnie. Bonnie joins the New Look TRAM team at such an important time. As we forge forward into a new era of research impact activities, we have also relocated into our new home here within the Melbourne Connect precinct. And while this cohort has thrived in digital delivery, we are very excited to welcome them and future generations of researchers into our new TRAM depot in the Melbourne Entrepreneurial Centre located here at Melbourne Connect. What makes today unique from other similar events is that our teams today are not trying to sell you a product, they're not pitching for money or competing for a trophy. Today is simply about celebrating 9 teams of researchers who have gone on 9 very different journeys after choosing to take their research and passion to the next level. We're excited to see 4 faculties and an institute from the Melbourne Biomedical Precinct represented here today. And we hope that you're inspired to ensure researchers from your faculty can participate in future TRAM programming. We've had some amazing support from our friends at the Research, Innovation and Commercialisation team all year. And at the end of these presentations, we'd specifically like to thank those who have mentored our teams one-to-one during the program. Time and time again, our teams tell us that the one-on-one mentorship and coaching is one of the most valuable things we can do to support them. These teams are here today because they want to see their research create change beyond the walls of the university. But they cannot do this alone. TRAM will always support our researchers where we can, but we need to ensure that we are creating a thriving culture across the university, where our researchers are given permission to dream, explore, and always ask, what if? This task sits with us, with you, our friends and allies from across the university at RIC, alumni of our programs, and all the way up to the top of our university leadership. So I ask you all today, if you have a contact who can help one of our teams, please take the time afterwards in the networking rooms to introduce yourself. If you're from a faculty or school that isn't represented today, please reach out to us so we can help you to work with your researchers to create that change. And if you're in a leadership role across the university, I'd like to encourage you to question what more can we be doing to support our researchers in creating impact outside of these walls. And with that, I'd like to excitedly hand back to Bonnie to introduce our first team for today.
Thank you, Andrew. So we first have our first team, and they have intrigued me since the very first day, working in a field close to my background, cancer research. Whole body analytics is using artificial intelligence to personalize colorectal cancer treatments. Please welcome Janan Arslan, Paul Baird, and Justin Young.
Thank you so much for your time today. My name is Janan, and today I will talk to you about whole body analytics and the use of artificial intelligence to personalize colorectal cancer treatments. The team consists of myself as the AI expert, Professor Justin Young as our clinician, and Professor Paul Baird as our geneticist. While we are experts from different fields, we have come together for one purpose, and that's to automate current clinical processes in order to improve patient outcomes. Colorectal cancer is the second leading cause of cancer-related deaths in Australia. While there are treatments available, how patients respond to these treatments is highly variable, with some patients experiencing adverse reactions and poor outcomes. Clinicians typically rely on these images called CT scans, which are cross-sectional scans of the human body. They look at the distribution of tissues within the scans and identify how well or how poorly a patient is going to respond to their treatment. Along with CT scans, clinicians use this software to highlight those regions of interest and extract information accordingly. But the problem with the software is that it requires a lot of manual work. One image can take the clinician up to half an hour to finalize. So we have tried to completely automate the process using artificial intelligence. On the left-hand side, we have the 2D component of our software. So with the click of a button, all of those regions of interest are automatically extracted for the clinician, and this takes 5 seconds. So this shows that our software is 360 times faster than the current software being used. We also have the 3D component of our software. So the 2D component only looks at particular regions in the body, whereas the 3D component allows us to look at the whole body. So this allows us to look at distribution of tissues throughout the whole body, including fat, and also allows us to look at the BMI as well, which will help better predict how well or how poorly a patient is going to respond to their treatment. Before TRAM, we did make a lot of assumptions. We were mainly focused on patients and colorectal cancer clinicians. We thought our product was so easy to use that no training would be required. We weren't sure how people would respond to AI. And in addition, we came up with the solution, but we didn't know if anyone wanted the solution. Thanks to TRAM, we have gained many insight and conducted many interviews. We have identified new customer bases. We have confirmed with both clinicians and patients that they really do want the software to be used for diagnostic processes. Clinicians have confirmed that yes, while the software is easy to use, some training is still essential for them to feel more comfortable using the software and for them to also better explain the software to their patients as well. We have identified that with a good product, we also need good customer service and good tech support, and we have also developed a 3-year plan. So the customers we have identified include hospital administrators who will help us integrate the software into clinical settings and into hospitals as well. And we have also identified clinicians who use CT scans for other purposes or other areas of medicine. So our next steps include internal validation, just to keep perfecting the software. Then after that, we have our first stage prospective study in which we run the AI diagnostic along with the clinician's diagnostic in parallel and then compare the two. And then we have our second stage prospective study in which the clinician will start using the AI for their diagnostic processes. And then finally, using all of this information, we will register the software with the Therapeutics Goods Australia. So that is it from us. If you are a clinician who uses CT scans for your analysis, including other cancers, veterinary, trauma, injury, or any other area of medicine, we'd love to hear from you. Please either email us on any one of these email addresses or reach out to us in the breakout rooms. Thank you so much for your time today, and thank you very much to TRAM.
Thank you, WBA team. Leveraging technology in the clinic doesn't stop there. Our next team is 3D printing veterinary simulators for learning and practicing clinical procedures. Please welcome Stuart Ryan, Julian DeAndrew, and Dongjing Kung.
Our team has been developing a 3D printed model for clinical procedures training. As clinical educators, we train both medical and veterinary students in basic and advanced clinical procedures, such as bronchoscopy, which involves placing a flexible endoscope into the airway. This procedure must be completed in a timely manner for the safety of the patient, who's often in a critical state. Currently, students gain most of their clinical training on the job. This creates a stressful learning environment and limits the opportunity for students to develop the skills they require to become competent. Other training options currently used include using dried out lungs from cadavers or virtual reality trainers, which are great but expensive.
We have produced a 3D printed airway model from a CT scan of a dog's lungs. The advantages of our model over other current training methods are that students can develop and practice bronchoscopy skills with direct real-time feedback from mentors in a safe learning environment. They can practice regularly and even make mistakes with no risk to patients. These videos are from a patient on the left and from our model on the right. As you can see, the model is very realistic. Our main considerations for the model were that the anatomy was accurate and realistic, replicates the bronchoscopy procedure, and that it would not damage the scope. We thought the main users of our model would be university teachers or continuing education providers running practical endoscopy workshops.
Taking the TRAM, we interviewed people in our main target groups, including students, educators, NC providers, as well as industry partners. We expanded our interview list to include endoscopy manufacturers, hospital administrators, and other companies selling training models. This interview provided valuable information that confirmed that there is a gap in the market for a model like ours. Students like the realism of the model and the ability to practice repeatedly at their own pace in their own time. Educators commented on the ability to structure learning objectives and do competency assessments. We also identified our model could be used for learning other clinical procedures. We listened and incorporated new ideas about business models, such as renting rather than purchasing the model. Through the interviews and questioning of our value proposition, we had confirmation from many different sources that our idea will provide a missing link in training for clinical procedures. We identified our primary customer group to be continuing education providers. The interview also provided some awareness of potential future hurdles, such as scale-up production and distribution logistics.
Our next steps are to use the information gained through TRAM to develop a business plan and secure funding to progress the commercialisation of our research. Based on feedback, we've developed new model prototypes and have other models under development for other high-risk clinical procedures like epidural injections. We'd like to thank Andrew and Bonnie for their mentorship in running an excellent program, and also to the other TRAM teams for their input and support. At this stage, we'd welcome any input and feedback, and specifically if you or someone you know is interested in helping us develop our training models, please feel free to get in touch. We're also keen to expand our team to include someone with business or marketing experience as we progress to the next stages. Thank you very much.
Amazing stuff, Stuart, Julian, and Dongjing. From saving pets in our homes to saving our furry friends in the wild, our next team is empowering the leaders of tomorrow in tackling prevalent environmental issues. Please welcome Natalie Krekler and Meenakshi Arora.
Hi, I'm Natalie Krekler from the Faculty of Veterinary and Agricultural Sciences, and I'm joining forces with my colleague Meenakshi Arora from the Faculty of Engineering and Information Technology to tackle a problem that we are both experiencing as parents of young, environmentally conscious children. We're both aware of a worrying trend in youth of increased eco-anxiety, which is the fear of environmental damage. Also, as part of the TRAC program, we did one small survey in Melbourne High School, and we found similar results with 90% of respondents having experienced eco-anxiety at some stage. And while there's huge enthusiasm among young people to be involved in environmental projects, the path to contribution is not always clear to them. On the other hand, there are organizations which are under increasing pressure to adopt sustainable practices. Our vision is to foster youth passion about environmental sustainability issues by bringing together various stakeholders. Before we started TRAM, Meenakshi and I both thought that young people would be our primary stakeholders. However, while conducting our interviews, we did find that young people are the ones that are aware of having a problem and actively looking for a solution. But we also found a second group of stakeholders in organizations that are already working in the space. They have already assembled part of a solution and acquired a budget.
Through these interviews, we found that young people are very keen to engage, but they are generally time poor and they don't always see the impact of their action. Therefore, they also struggle to find the relevant opportunities. On the other hand, organizations we interviewed are doing great work driven by either policy or corporate social responsibility, but they mostly work in silos and also struggle to find enough young volunteers. So our solution to this problem and value proposition is to create a multi-sided platform that can bring these two groups together. The platform will allow organizations to advertise their events and work together, as well as allow young people to get involved. Additionally, young people will be able to post their own ideas for support and funding. So as next steps, we are looking to expand our team, especially someone with software development experience will be great. We are also looking to acquire some funding to build a pilot platform and begin the testing with some schools and organizations. So if you share our vision and passion, please get in touch, and here are our contact details. And thank you very much for your time today. We would also like to thank Andrew, Bonnie, and all other fellow track team members who have been supporting us over the last 8 weeks. Thank you once again.
Thanks, Natalie and Meenakshi. Now, I'm sure we all know someone who has experienced an ACL injury. Next up, we have Hossein Mokhtazadeh, who is working towards 0 ACL injuries. You're the only one I can say this to. Break a leg, Hossein.
Hello everyone, this is Hossein Mokhtazadeh, and I would like to talk about ACL injury. Before the TRAM program, I wanted to focus on unhealthy aging, but eventually I realized that healthy and fit athletes would benefit more from what I propose here. So the question is, how can we prevent ACL injury, which is a knee injury, and what are the most high-risk activities? So why ACL injury is important? I asked basically a FLW player, and one of them told me that 1 in 6 players have an ACL injury per season. And as you can see here, female athletes are more likely to get ACL injury up to 8 times. And if you don't have private health insurance or Medicare, so pretty much you'll pay all the costs. So my question first was, how can I identify my customers? So when you look at all the stakeholders in AFL, FLWC players, insurance, fans, clubs, coaches, they're all involved so that players can play well. But my main customers are players, coaches, and clubs. Coaches involved in medical experts and physios. So as I said, why can't we prevent ACL injury? In my opinion, the hypothesis is because we don't really know how the muscles and joints react just at the time that ACL injury happens. So the programs has to be personalized. That's why I did my PhD on ACL injury. I asked people to do different activities for me, like high risk, and then develop computer-based models and also validate some part of it. And then I can actually now tell what the role of muscles and joints would be toward ACL injury or prevention. So after again talking to so many people, I realized that we need to do some pre-screening, pre-season screening, understand how people actually athletes would move. Then develop a computer-based model from every single person. And now we have Sarah's personalized preventive training. So I'll give them this type of information, very quantified one, to the coaches so that they know which muscle group or which joints are responsible for ACL injury. And then they can focus on those type of joints and muscles. So basically, Sarah will go through the preseason screening, and then the model will be created for her. And we will give her and the coaches, with the coaches and the players, we can give them personalized training. And this can be done again and again every 6 months. So the whole idea here is to avoid what we have currently, which is the ACL injury happens and then reconstruction, which is really costly, so that we can actually have a new proposal here so that every player can keep playing from now. The next steps would be implementation of this new proposal. And if you are interested, your team is interested in developing more of this proposal, please contact me. I'd like to thank the TRAM team, especially Andrew and Bonnie and all the colleagues here.
Thanks, Hossein. From the leg, let's work our way up the body to the lung. Our next team is from the Biomedical Precinct, Monash Institute of Pharmaceutical Sciences, who have undertaken a drug discovery venture to find novel treatments for pulmonary fibrosis. Take it away, Karen Gregory, Katie Leach, and Jain Diao.
Hi, we're Karen, Katie and Jain from the Endocrine, Respiratory and Neuropharmacology Group at Monash Institute of Pharmaceutical Sciences, joining the TRAM program through the Biomedical Precinct. We're going to present today our journey towards the development of novel drug treatments for pulmonary fibrosis. Pulmonary fibrosis is scarring of the lungs. Approximately 20% of pulmonary fibrosis cases are caused by idiopathic pulmonary fibrosis of unknown cause, and the incidence is increasing worldwide. So 2 currently approved drugs on the market slow but do not halt fibrosis. So there's a significant need for new drugs for this large market.
We have identified a protein that is increased in lung diseases. What's really exciting is that our inhibitor of this protein is anti-fibrotic and improves lung function, which is not shared by any other inhibitors of this protein, pointing to novel action of the mechanisms. Our novel drug that inhibits this protein could be a new medicine to benefit patients and society. When we first started TRAM, we were focused on developing long-acting inhibitors of our novel protein for severe asthma, based on exciting findings from my PhD showing multiple beneficial effects in the lungs.
We then conducted interviews with key stakeholders, and in discussions with experts in intellectual property and commercialization, we quickly found out that we had no freedom to operate in asthma or in inflammatory lung diseases. We then turned our efforts to talking with other customers, and in discussions with respiratory clinicians and clinical researchers, we found out that pulmonary fibrosis is not an inflammatory lung disease, offering a new avenue for discovery for our inhibitors. We then spoke with formulation and drug delivery scientists who helped us to identify that direct targeting of the lungs would be really important to consider early in our discovery pipeline. Discussions with biotech and pharma revealed that choosing preclinical models that translate to patient disease is a major challenge in this field. Also, that tolerability is just as important as efficacy, as well as considering cost and ease of manufacture of our small molecule inhibitors. So the next steps for us are to focus on disease models that are relevant for fibrosis, and to use these to validate the proof of concept that our novel inhibitors will improve function and decrease and slow fibrosis. We'll then seek to find new chemical composition and undertake further optimization. And long term, we'll look to find partners to help take our new medicine for pulmonary fibrosis to the clinic.
So just to recap, our team at MIPS have identified a novel drug to treat pulmonary fibrosis. If you think you can help us on our journey towards the development of our drug, then please get in touch using the email addresses shown here.
Thanks, Karen, Katie, and Jayen. Now, from the lungs to little hands, our next team is gamifying the way we teach children hand hygiene, which is particularly important in the setting of a global pandemic. For the parents in the Zoom room, listen up and grab your kids. Please welcome Ruby Beeson from Serious Gamers.
Hi, my name is Ruby Beeson, and I represent the team Serious Gamers. And my project is on promoting hand hygiene in young children through educational gaming. Hand hygiene plays an important role in health. Effective hand hygiene leads to the reduction of infectious diseases such as respiratory tract infections and gastrointestinal infections, especially in childcare centres, school and in the home. This not only affects children's health, but also absenteeism in school and productivity for parents being away from work. Poor hand hygiene habits may be due to poor teaching or role modelling, and the lack of knowledge and skills can hinder the sustainability of this practice. If we can teach young children early, help them understand why hand hygiene is important, we can sustain their hand hygiene practice in life. So critical hypotheses are children lack hand hygiene knowledge and not being taught proper hand hygiene practice. Also, parents are frustrated with teaching young children hand washing. In a TRAM course, I interviewed 21 parents and grandparents with young children, childcare staff and educators, kinder and primary school educators. We want to know who is teaching kids hand hygiene, at what age, and what frustration they may encounter. So some of the key things we learn are parents have different expectations when it comes to when their children should wash their hands. It is clear that hand hygiene should be taught by parents early in life through role modelling, and childcare, kinder and schools should reinforce the hand hygiene habit. However, there are disconnects between parents, childcare and school educators that they don't know if children are being taught hand hygiene, who is teaching hand hygiene, and whether this habit is being reinforced at childcare, kinders and schools. So in this process, we found that parents, educators and the wider community all have a problem and they are looking for a solution. However, the disconnect of parents and the problem taught us early that they are unlikely to be our first customer. Hence, we're targeting more broad-reaching customers such as the Department of Health and the Department of Education, who see value in a unified and consistent solution. In doing this work, we'll be able to help parents and educators to help young children understand why hand washing is important. The exciting new steps are that we have developed a hand hygiene game called Happy Little Hands, and we'll be piloting this into a primary school next month. We're keen to explore whether this game will translate into awareness and understanding of transmission, and whether this knowledge will translate into sustaining habit. We're keen to explore areas for funding opportunities to move to the next steps, and would love to hear from you if you have any connection with the Department of Education or the Department of Health who might be interested in this important area. Here are my contact details. A big thank you to Andrew and Bonnie and the TRAM team for this great program. Thank you.
Thank you, Ruby. Now, from little hands to big public infrastructure, I'd like to welcome Hemanta Deloy from Social Value Model, who is integrating social value in the decision-making process of public infrastructure projects.
Hello everyone, I am SVM team. My project is about creating a new capacity for evaluating capital-intensive public infrastructure projects using objective social value performance instead of the prevalent cost-benefit analysis alone. The way the current projects are being developed using the taxpayers' funds, some of the highly successful business propositions have failed to win the market capitalization from community viewpoints. One key example is the East-West Link project, where due to an unprecedented community backlash, the project was cancelled and over $1 billion was spent as a kill fee just not to have the project. There are plenty of evidence of multi-billion-dollar projects at our doorsteps where similar stories exist. While many of these projects are perhaps successful from economic perspectives, they failed in social capitalizations. The current Melbourne Metro project is also not an exception. There are groups of people who are either left out or never involved in any participatory discussions in the currency of the project. Hence, in my research, I sought the answer to this billion-dollar question. How can we ensure a complete integration of social value in the decision-making process? I developed a model simply to address this and save billions. Focusing on the big data analytics technique, social network analysis was employed to map the project-related issues with the people in the community. The project is then scrutinized in relation to the understanding, interest, impacts of every single person so that the social benefits can be measured objectively. In the current cost-benefit analysis, benefits are highly subjective and cost changes all the time, and thus cost-benefit analysis as a criteria is compromised. The network-based methodology is highly effective to understand the interconnectedness of different stakeholders and their collective influence in projects. The traditional Excel-based project development practice is no more effective in design and development of our 21st century's complex projects. This picture of a theater show is a classic metaphor of the consideration in my social value model, where not only the roles of the key members in the stage are considered important, but also the significance of the subordinate roles to drive the success is also equally important. During the TRAM program over last 8 weeks, I have had the opportunity to talk to over 15 key people in the industry to test the efficacy and validation of the model. The quoted statements validate the model as a need of the hour. The graph shows the conceptual representation of how the model works. The blue line depicts the social threshold of the project measured through rigorous consultation of the community at the concept stage of the project. The green line is the perceived social value presented by the project solution. The red line is the social value deterioration in the do-nothing scenario. So the target is to design and develop the project in such a way that the green line meets the blue line, and the gap between these two lines is the social value gap. Once such a quantification is realized, social value can be ensured, optimized, and trusted. Having done the interviews, I have identified the customers who will benefit from this model in 3 groups. Among the 3, the very first group will be a few local councils, followed by a few departments within the state government. I am currently actively looking for a few projects to continue testing the model. The model is ready. Data collection template is very simple and user-friendly, very easy to implement, and it is highly scalable. It provides high transparency and accountability in the project, and this is very inexpensive to implement. My contact details are provided. I'm Hemanta Doloy, an associate professor at the Faculty of Architecture, Building and Planning. Thanks to Andrew, Bonnie, and the TRAM team for providing me this opportunity. Thank you very much.
Thank you, Hemanta. From new approaches in infrastructure to new approaches in farming, our next team are working on an urban hydroponic vertical farming solution for growing microgreens. Please welcome Doreen Gupta, Graham Brody, Alexis Pang, and Sigfredo Fuentes from Grow Hydro Solutions.
Hello, we are Grow Hydro Solutions team comprising myself, Graham Brody, Sigfredo, and Alexis from Faculty of Veterinary and Agriculture Science. The bigger challenge humanity is going to face is around the food security of the people. And by 2050, we will be more than 9 billion on this earth. So to feed everybody around the world, we need to produce double the amount of food from half of the resources we have today. At the same time, we also need to reduce our food miles so that we have less negative impact on environment. One of the solutions to solve this bigger problem is vertical hydroponic farms under controlled environments. And the market value of this particular industry is nearly 2.7 billion, where in the next 10 years, nearly 4,000 jobs could be easily created through this industry. Microgreens, that's not a new crop. It's already in supermarkets and also in restaurants. It's nutrient-dense vegetable confetti, which is rich in nutrients so as in its sensory value.
Before we started in the TRAM program, we thought that the problem that we were trying to solve was resource use efficiency in vertical farming. And we thought that the solution that we would provide would be sensors for automatic microgreen production. What we now realize, after conducting many interviews with companies, consultants, government and councils, is that the hydroponic industry is fragmented and disparate. It varies in its scale and its distribution. And what is needed is customized agronomic advice for crop choice, resource use, and waste management. Now we realize that what we're going to be offering is tailored advice and solutions at different scales. We believe that we're going to become a service provider. That service may still include our automated systems, but it will be much more.
So value proposition with our first targeted customers being microgreen producers supplying to restaurants and supermarkets. We know what growers are looking for are tailored advice and customized solutions in the areas of agronomy and technology. We will be an advisory service that is professional, science-based, and personal, leveraging of our reputation as researchers and innovators from the University of Melbourne. We know for growers, trust in the person giving the advice is paramount. Our product is our expert advice, and we will not be trying to sell anything else such as fertilizers or machinery. No hidden agenda. All this will be based on our combined expertise in multiple fields such as crop science, growing media for water and nutrient use efficiency, electrical engineering for sensors and system integration, data analytics, and machine learning. All these enhanced by access to our world-class scientific facilities and labs. Okay, next steps. So what we need next is, firstly, assistance with branding of our company and services. Secondly, support in establishing a live running vertical hydroponic facility for crop-specific work and technology demonstration. And thirdly, help with establishing the right networks with potential industry partners as well as investors. So thank you for listening to Grow Hydro Solutions. Thanks to our fellow TRAM participants, our mentor, Dr. Greg Harper, and Andrew and Bonnie, our coaches. Please feel free to contact us.
Thank you, team. Let's go from microgreens to big data. Our final team is tapping into big data and bringing it into the hands of researchers. Let's hear from Simon Dennis and Ben Stone from Unforgettable Research Services.
As we go about our daily lives, we are constantly interacting with technologies that record what we are doing, thinking, and feeling. Our smartphones, smartwatches, laptops, and increasingly our connected appliances provide data that can help researchers to understand human behaviour. Up to now, researchers have used surveys, experiments, and interviews. These can tell us a lot about people, but they occur at just one point in time and take people out of their normal contexts. People change, and what they do depends on what is happening around them. The success of big tech companies like Google, Twitter, and Facebook shows how big personal data can help to predict human behaviour. I am Simon Dennis, and I am the CEO of Unforgettable Research Services. Our vision is to make big data accessible to the research community. At Unforgettable, when a researcher needs data, we send out a request to our users. Alternatively, if the researcher needs people from a specific population, we can help with recruitment. Unlike many services, our users are paid and retain ownership of their data. Their privacy is maintained because the researcher doesn't see the data, only the results of their analyses. Currently, we have more than 4,000 Unforgettable users who can collect data from over 600 sources. These include their locations, app and phone usage, email, browsing histories, social media posts, step counts, and sleep data. Many standard surveys on demographics, personality, beliefs and values, etc. are built into the system, and researchers can create their own. Right now, not many researchers are using big data. The central question for us is why? Before we started TramTrack, we thought researchers were primarily concerned that it would take too long and be too expensive. Through the interviews we have been conducting in the program, we have discovered that these are not the most immediate problems. The biggest issue researchers face is figuring out how to take huge data sets and extract variables that they can relate to their theory. Some people found the wide array of apps and services that are available difficult to navigate and needed help knowing what to choose. Others had been disappointed by the reliability of the technologies they had used. We need to support researchers through the entire process, starting by taking the time to understand the research questions they are trying to address, so that we can provide advice on the right data sources for their problems. The reliability of the data collection process needs to be a major focus, and since starting the TRACK program, we have added several mechanisms to dramatically improve the robustness of our collection technologies. We have also created a new interface designed to look and feel familiar to researchers. The new interface makes it easy to use basic statistical methods and provides a suite of standard plotting tools. Under the hood, there are sophisticated machine learning models, causal analysis methods, and sentiment analysis tools. We believe that progress in the behavioural and medical sciences hinges on the use of big, dense, personal data. We are looking for introductions to individual researchers who would benefit from access to big data, and we would like to meet with deans, heads of school, and centre directors to discuss ways that we could provide access to our system for their research units. We would like to thank Andrew, Bonnie and the whole cohort for their support and assistance during the TramTrack program. We have learned a lot and wish everyone well in their translational journeys.
Thanks, Simon and Ben, for rounding off our final presentation. What an incredible job all of our teams have done this semester. You have wholeheartedly embraced the tram journey, which at times has felt like a bumpy Melbourne tram, but your hard work shows, and the proof is in the pudding, or should I say in the presentation. To all of our teams, give yourself a big pat on the back, and the audience, please join me in giving all the teams a big virtual round of applause. So there is another group of people we have to thank, and that's our TRAM track mentors from across the university who have volunteered up their time and passionate energy to support and guide the teams along their research impact journey. We've heard week after week from our teams that the sessions with their mentors have been incredibly helpful. So a big thank you to you. I'd also like to extend this thank you to the entirety of our team who has made this night possible. Go the TRAM fam. This brings us to the end of the track presentation day. Now it is time to jump into the networking Zoom room. We will share a link in the chat. It can also be found in your email ticket and on the Eventbrite. In that Zoom room, we will open up breakout rooms for each team. These breakout rooms will be self-selecting, so you can jump around and chat to as many teams as you'd like. If you have any issues with these breakout rooms, just give us a yell. But we've hoped you've enjoyed this ARVO as much as we have. Thank you so much for joining.